Okay, so this is procedural steps in order to do health screenings with the NIHHC. When the person first arrives, go ahead and greet them. Hola, señor.
Hola.
And ask them to hand you their lanyard. The top part will previously be filled out by our people at the front table, and this is the place where you are going to record the results. Please make sure you mark firmly the results and clearly, and that you put your initials beside the screening that you have done. For instance, now we are going to do cholesterol, glucose, and we're going to do blood pressure and pulse, which is way at the bottom. Please don't forget that. We're going to initial at where we do the screenings. So the first thing we're going to do is ask the person to please sign in the sign-in sheet. They will have several sheets to sign in, which will give you plenty of time to get your materials prepared. And in your, se puede apuntar por favor aquí en todas las áreas. And you will have your station prepared with a caddy with the materials that you'll need, as well as your machines, some gloves, and some hand sanitizer. So you'll have everything you need to get started. While the person gets set up, you can also get set up. Ask the person their name. ¿Cómo se llama, señor?
Mario.
Mario. ¿Y su apellido?
Pulgar.
Okay, so he's Mario Pulgar. Go ahead and place his initials at the top part. Initials is all we need, but do mark it firmly because this has to go through like 4 copies and a back one. So just make sure you write clearly and firmly. Okay, Senor Mario. So first of all, we're gonna check his blood pressure. Go ahead and ask for his arm, ask the person to sit quietly with both feet on the floor, and go ahead and place the bracelet on them. Vamos a checar su presión, señor Mario. Try to place the bracelet 2 fingers above the crease of the elbow. No cruce sus pies, póngalos derechitos, and then just turn on your machine. While that is happening, you can go ahead and prepare your area. You're going to open up a sterile gauze and have that be kind of your mat. Once you get the blood pressure reading, you're going to write it in the sheet. You're going to tell the person 141/80 y su pulso 103. You remove the bracelet and make sure you're recorded. So blood pressure here would be right here, 141/80, my initials, and the pulse 103. If they ask you questions about the results, if it's high or low, just let them know that somebody will explain results in a little bit in a different area. So once we're done with that, then we're gonna prepare for the poking. You will have a cholesterol machine and a glucometer, which is what we're going to use. If the person is fasting, we are going to be using the lipid panel because it's a wider, that's going to actually measure triglycerides, HDL, LDL. If the person is not fasting, we're going to be using just a cholesterol strip. The difference between these two, cholesterol is red, lipids is a black, and that goes along with their capillaries. You use a red capillary for the cholesterol and a black capillary for the lipid panel. So in this case, Mario is not fasting, so we're going to go ahead and do a cholesterol test. Turn on your machine. It's going to ask you for a chip that comes here with the test strips. So the machine says install memo chip. Just make sure the chip number goes along with what it says on the bottle. This is C204. So C204, insert the chip in the machine. And it's ready. Chip C204, insert test strip. So that's ready. You can even take it out and place it here. And you're gonna prepare your glucose strip as well. These are self-coating, so you don't need to take care of anything there. But that's the one that's gonna go on the glucometer. And you can get your lancet, which is also disposable, and you can get your Band-Aid prepared. Okay, so done on some gloves. Oh, and your prep pad. You'll have a prep pad here. Okay, so once you have all that ready and your machine's prepared, then you can glove it down on some gloves. Tell the person what you're doing. Le voy a dar un piquetito, señor. De ese mismo piquetito vamos a tomar todo. So go ahead and get your prep pad and clean one of the fingers. And wait until it is all dried out before pricking your finger. The first test you're going to run will be the cholesterol or lipid panel, because that's the one that takes the longer. So you can do other things while that one is testing. So what I do is I take the gauze and I kind of just hug the finger that I'm gonna poke with it. Take my lancet, un piquetito, señor. Poke the side. You'll get 1 drop of blood, which I usually clean off first. And then the next drop will be the one we're going to use. Puedo dejar acá su manita aquí sobre. So you take one of your capillaries and you need to fill it to this line with this blood. So make sure you get a nice drop here. You don't need to apply any pressure. It's just gonna go into the tube, but you do need to get enough so that the machine can read. So I'm almost there. Okay, once I have enough, I just tell the person to stay put for a moment. And insert my strip. And go ahead and press the top to fill it completely. Okay, once that's done, I can go ahead and get my glucose sample. So I stick the test strip in here, and it's going to ask me for my drop of blood. So while that's testing, I go ahead and get another drop of blood for my glucose. And that's testing too. I just help the person clean up and place a Band-Aid. This goes into my sharps container. I can recap it. It's only a one-use thing, so it goes into the sharps container. Everything else can go in the trash. And I already have a glucose reading. So it's 116. I'm gonna go ahead and write it down here. Glucose is 116, and my initials pressing firmly. And now we have a test result of cholesterol 103. So we write that in. That should be it. Make sure it has copied through all of the pages, and then you send the patient on their way to get their results explained. If they are diabetic, it should say so here, and they have a glucose reading over 170, then we run an A1C test, and somebody else will do that for you. Just let them know. And if they're non-diabetic and they have a 150 glucose, then we run an A1C test. So just if you come up with any of those, please let one of the personnel know so that they can run an A1C test. And that's all. Muchas gracias, señor. Puede pasar a la siguiente estación.
Gracias.